Hello, I'm Dr. Shin from Korea. I'm the first author of the paper entitled Preliminary Feasibility Study of a New Partially Covered Self-Expandable Metal Stent with an Anchoring Flange for Endoscopic Ultrasound-Guided Hepaticogastrostomy. Endoscopic ultrasound-guided hepaticogastrostomy is a novel drainage technique that provides biliary decompression from the left intrahepatic duct to the stomach, which can be used as an alternative drainage method after failed ERCP. Although previous studies suggested that EUS-guided hepaticogastrostomy is effective and safe, there are concerns about the risk of severe adverse events such as stent migration and bile leakage. In this study, we evaluated the feasibility and safety of a new partially covered metal stent with a distal radiopaque anchoring flange, which was developed by our corresponding author, Professor Jong-ho Moon. The newly developed partially covered stent is made of braided nitinol wire with a silicone membrane. The novel stent is 8 or 10 mm in diameter and 6, 8, 10 or 12 cm in length and has an 8.5 French delivery system. At the proximal end, a radiopaque flared uncovered portion of 1.5 cm in length embeds into the bile duct to prevent distal stent migration. This uncovered portion prevents cholangitis caused by obstruction of a side branch of the intrahepatic duct. At the distal end of the covered portion, a fold-back wide anchoring flange of 20 mm diameter is attached to prevent proximal stent migration and enable additional interventional procedures through the stent. Radiopaque markers are applied to the proximal and distal end to facilitate intrahepatic and intragastric stent deployment. The primary outcome was the technical and clinical success of EUS-guided hepaticogastrostomy. Secondary outcomes were adverse events, reintervention for recurrent biliary obstruction, and technical feasibility of poorer cholangioscopy through the stent. As a result, the technical and clinical success of EUS-guided hepaticogastrostomy using the newly developed stent was 100% and 91.7% respectively. Adverse events occurred in 8.3% of the patients and were managed successfully by conservative treatment. The median cumulative time for recurrent biliary obstruction was 6.7 months. In patients who underwent poorer cholangioscopy through the stent, the technical feasibility was 87.5%. In conclusion, EUS-guided hepaticogastrostomy using a new partially covered self-expandable metal stent successfully relieved malignant biliary obstruction after failed ERCP. The new stent prevented stent-related adverse events, including proximal and distal stent migration, and permitted advanced endoscopic interventions through the hepaticogastrostomy route. Thank you so much.